When I think of my role as director of the Center for Global and Immigrant Health at the Fielding School, and how my personal journey has brought me to my current professional path, I think of myself as a 6-year-old girl. I was 6 when I immigrated to San Francisco, first to the Tenderloin district, living in a short-term studio apartment, then later in a neighborhood called Sunset, first in an apartment, then later in a house that has been my family home since the 70s. My parents grew up in rural Philippines, went to college in the big city, Manila, then immigrated to San Francisco. Unlike most other Filipino families new to America, I was an only child and had a room of my own. My friends thought I was so lucky. But because we had a really hard time the first year we immigrated, my parents' policy was to welcome and host all newcomers that needed a place to stay, to ease that time of transition for others. And that meant I had to share my room. First, it was close relatives, aunts and cousins, then friends of family. Then, because I'm from a family of teachers, the door was open to students of my relatives coming to the U.S. with the hopes of getting a job and getting a better life. Some stayed 5 days. Some stayed 5 years. I saw my parents' generosity in their small 2-bedroom home, providing shelter, good food. My mom was a magical cook, turning canned goods into exquisite meals on the spot. Tours of Twin Peaks and Golden Gate Bridge, maps and instructions on the local transit systems, and the laundromat down the street. Borrowed ties and jackets for job interviews. Most of all, my parents gave great parties, celebrating the lives of our guests. That I remember the most. But I also remember one guest who cried all night and my mother comforting her. It was a one-stop safety net for what seemed to me a huge village from the Philippines. I rarely had the room to myself. I lost both of my parents recently, and an outpouring of emails from so many places in the US and Canada, giving thanks and sharing fond memories of their time at our home. I guess my parents' generosity has left a legacy in many people. For me, it has shaped my belief that the Center for Global and Immigrant Health at the Fielding School must be a place where collaborations are nurtured and championed, bringing together like minds across the globe, across disciplines, between students and faculty to lead public health and social change at home and the world. It is a place that can house my research and the research of others in sustaining the safety net for immigrants. My room was my world, and I am grateful to my parents for making me share it.